Sleep apnea is a serious sleep disorder that occurs when a person's breathing is repeatedly interrupted during sleep. These pauses in breathing can last for a few seconds to a minute and may happen dozens or even hundreds of times a night. The most common type is obstructive sleep apnea, which happens when the airway collapses or becomes blocked. There is also central sleep apnea, CSA, where the brain fails to send proper signals to the muscles that control breathing. A mixed type can also occur, combining features of both. One of the most noticeable symptoms of sleep apnea is loud, chronic snoring, often followed by gasping, choking, or snorting sounds as the body struggles to resume breathing. People with sleep apnea may not be aware of these interruptions, but they often wake up feeling unrefreshed, even after what seems like a full night's sleep. Other common symptoms include excessive daytime sleepiness, morning headaches, difficulty concentrating, irritability, and memory problems. Left untreated, these symptoms can significantly impact quality of life and daily functioning. The health risks associated with sleep apnea extend far beyond poor sleep. Frequent drops in blood oxygen can strain the cardiovascular system, raising the risk of high blood pressure, heart disease, stroke, and irregular heart rhythms. Sleep apnea has also been linked to type 2 diabetes, obesity, and an increased risk of accidents due to drowsiness. Over time, the condition can place a heavy burden on both physical and mental health, making proper diagnosis and treatment essential. Diagnosis usually involves an overnight sleep study, polysomnography, where breathing patterns, oxygen levels, heart activity, and brain waves are monitored. Once diagnosed, treatment depends on the severity and cause of the apnea. Lifestyle changes such as weight loss, avoiding alcohol, quitting smoking, and sleeping on one side may help mild cases. The most common treatment for moderate to severe sleep apnea is continuous positive airway pressure, CPAP therapy, which uses a machine to deliver air pressure through a mask to keep the airway open. In some cases, oral appliances or surgery may be recommended. Living with sleep apnea can be challenging, but with proper treatment, many people experience dramatic improvements in their health and overall quality of life. Effective management not only restores restful sleep but also reduces the risk of serious medical complications. Awareness and early detection are key, since many people with sleep apnea remain undiagnosed. Understanding the symptoms and seeking medical help can be life-changing. Obstructive sleep apnea, OSA, is the most common form of sleep apnea caused by the repeated collapse or blockage of the upper airway during sleep. When this happens, airflow is restricted or completely stopped, despite ongoing efforts by the body to breathe. These breathing interruptions can last several seconds and occur many times throughout the night, disrupting normal sleep patterns. OSA is often associated with risk factors such as obesity, a large neck circumference, or anatomical differences in the airway, but it can affect individuals of all ages and body types. One of the most recognizable signs of obstructive sleep apnea is loud, chronic snoring, often accompanied by choking or gasping sounds as the body struggles to restore airflow. People with OSA may also experience restless sleep, frequent awakenings, and morning headaches. Because these pauses in breathing disturb normal sleep cycles, individuals often wake feeling unrefreshed and suffer from excessive daytime sleepiness, poor concentration, mood swings, and reduced alertness. This can interfere with work performance, memory, and even safe driving. Beyond sleep disruption, obstructive sleep apnea poses serious risks to long-term health. The repeated drops in blood oxygen during apnea episodes place stress on the cardiovascular system, contributing to high blood pressure, heart disease, irregular heart rhythms, and stroke. OSA has also been linked to insulin resistance, type 2 diabetes, and obesity, creating a cycle where each condition worsens the other. If left untreated, these complications can significantly reduce both quality of life and life expectancy. Diagnosis of OSA typically requires a sleep study, polysomnography, conducted in a sleep lab or at home using specialized equipment. This test measures breathing, oxygen levels, heart activity, and brain waves to confirm the presence and severity of the disorder. Once diagnosed, treatment depends on the individual's condition. For mild cases, lifestyle changes such as weight loss, exercise, avoiding alcohol, and sleeping on one side may be effective. For more severe cases, the most widely used treatment is continuous positive airway pressure, CPAP therapy, which delivers a constant flow of air through a mask to keep the airway open. Although living with obstructive sleep apnea can be difficult, effective treatment can be life-changing. Many patients who consistently use CPAP or other prescribed therapies report better sleep quality, improved energy, sharper focus, and reduced health risks. Oral appliances, positional therapy, and in some cases, surgical procedures may also provide relief. Since OSA often goes undiagnosed, raising awareness of its symptoms and encouraging medical evaluation are critical steps toward prevention and management. Addressing obstructive sleep apnea not only improves nightly rest, but also supports long-term health and well-being. Central sleep apnea, CSA, is a less common but serious type of sleep disorder that occurs when the brain temporarily fails to send proper signals to the muscles responsible for breathing. Unlike obstructive sleep apnea, where the airway is physically blocked, central sleep apnea is related to the communication between the brain and respiratory system. During these episodes, breathing may stop for several seconds or longer, leading to drops in oxygen levels and frequent disruptions in sleep. CSA is often associated with certain medical conditions, medications, or neurological problems. The symptoms of central sleep apnea can be subtle and sometimes overlap with obstructive sleep apnea. People with CSA may experience irregular breathing patterns, frequent nighttime awakenings, difficulty staying asleep, and excessive daytime sleepiness. Unlike OSA, loud snoring is less common, though some individuals may still snore. Morning headaches, poor concentration, irritability, and fatigue are common consequences of the fragmented sleep caused by CSA. Because these symptoms can mimic other health problems, CSA often goes undiagnosed without a sleep study. Central sleep apnea is frequently linked to underlying health conditions. It may occur in people with heart failure, stroke, kidney disease, or certain neurological disorders. The use of opioid medications can also depress the brain's control of breathing, contributing to CSA. High altitudes can temporarily trigger CSA as well, due to changes in oxygen levels. Identifying and addressing these underlying causes is a key part of managing the disorder. Diagnosis usually requires an overnight polysomnography, sleep study, which records breathing patterns, oxygen levels, heart activity, and brain function during sleep. The results help distinguish central sleep apnea from obstructive sleep apnea. Treatment often focuses on addressing the underlying medical condition and may include therapies such as adaptive servo-ventilation, ASV, continuous positive airway pressure, CPAP, or supplemental oxygen. In cases where medications or heart conditions are contributing factors, adjusting treatments may help reduce apnea episodes. Living with central sleep apnea can be challenging, but effective treatment can greatly improve both sleep quality and overall health. Managing CSA not only reduces nighttime breathing disturbances, but also lowers the risk of complications related to low oxygen levels, such as heart strain and fatigue-related accidents. Because CSA is less common and often tied to serious medical issues, early detection and proper treatment are essential. Awareness of this condition ensures that people at risk, especially those with heart or neurological problems, seek medical evaluation and receive the right care. Sleep apnea is typically treated with medical devices like CPAP or in some cases surgery. But many people also explore natural and holistic remedies to improve their condition and support overall health. These approaches may not replace medical treatment for moderate to severe cases, but they can complement traditional therapies and, for mild cases, sometimes provide significant relief. Holistic remedies focus on lifestyle adjustments, natural therapies, and practices that strengthen the body's ability to maintain healthy breathing patterns during sleep. One of the most effective natural remedies for sleep apnea is weight management. Excess weight, particularly around the neck and upper airway, can increase the risk of airway obstruction. Studies show that even modest weight loss can reduce the severity of obstructive sleep apnea and improve sleep quality. Alongside weight control, regular exercise not only helps maintain a healthy body weight, but also strengthens respiratory muscles, improves circulation, and promotes deeper, more restorative sleep. Another holistic approach involves sleep position therapy. People with obstructive sleep apnea often experience worse symptoms when lying on their back, as gravity causes the tongue and soft tissues to collapse into the airway. Training the body to sleep on the side can greatly reduce breathing interruptions. Some individuals use special pillows or positional devices, while others find success with simple tricks such as sewing a tennis ball into the back of a pajama top to discourage rolling onto the back. In addition to lifestyle adjustments, natural remedies such as herbal therapies, essential oils, and breathing exercises can help improve sleep quality. For instance, herbs like valerian root, chamomile, and passion flower may promote relaxation and deeper sleep. Essential oils such as lavender or peppermint can be used in aromatherapy to reduce nasal congestion and support airway openness. Practices like yoga and diaphragmatic breathing exercises not only lower stress, but also improve lung capacity and oxygen intake, which may ease some symptoms of sleep apnea. Lastly, holistic health emphasizes reducing factors that worsen sleep apnea. Avoiding alcohol and sedatives before bedtime can prevent excessive airway relaxation, while quitting smoking reduces inflammation and fluid retention in the throat. Maintaining good sleep hygiene, such as going to bed at consistent times, keeping a dark and quiet environment, and limiting screen use before sleep, also supports healthy rest. While natural remedies alone may not cure sleep apnea, they can significantly improve sleep quality, reduce the severity of symptoms, and enhance overall well-being when combined with medical guidance. Thank you so much for taking the time to watch this informative video on sleep apnea. We truly appreciate your interest in learning more about this important health condition that affects millions of people worldwide. Your support means a lot, and we hope the information shared today gave you valuable insights into the causes, symptoms, and treatments available for better sleep and overall health. If you found this video helpful, we'd love for you to like the video and leave a comment below. Share your thoughts, personal experiences, or any questions you may have. We enjoy hearing from you and engaging in meaningful conversations. Your feedback helps us create content that is both informative and useful for everyone in the community. We also encourage you to share this video with as many people as possible. Sleep apnea often goes undiagnosed, and spreading awareness could make a real difference in someone's life. Whether it's with friends, family, or coworkers, sharing this video can help others recognize the signs of sleep apnea and encourage them to seek the care they need. Together, we can help more people take control of their sleep and health. And don't forget, this is just the beginning. Stay tuned for our next video, where we'll continue exploring important health topics that can empower you to live a healthier, happier life. Make sure to subscribe so you don't miss out. And once again, thank you for being part of this journey with us. Your support keeps us going, and we can't wait to share more with you soon.